Good morning. Thank you for being here. My name is Irving Gold. I'm the CEO of the Canadian Association of Occupational Therapy. We represent more than 20,000 occupational therapists, assistants, and students working on the front lines of healthcare. Somewhere in northern Saskatchewan, a child with cerebral palsy is waiting months for help learning to dress herself. In a remote First Nations community in northern Ontario, an elder recovering from a stroke has no one to help him relearn how to cook, manage his medications, and safely navigate his own home. In a small town in Cape Breton, a veteran with traumatic brain injury has just been told that the nearest occupational therapist is a 4-hour drive away. And in Dauphin, Manitoba, an older woman in long-term care is on an OT wait list. She wants help getting dressed in the morning. She wants to be able to feed herself. She wants to feel like herself again. The problem is that there's only one occupational therapist for her entire facility. That OT is doing everything they can, but they're triaging, deciding every day who's most urgent, who can wait. And some residents, people who have worked their entire lives, raised families, and built this country, will not make it to the top of that list. These are not hypothetical cases. They're happening right now in communities across the country. And they're the reason why we are here today. The federal government recently announced another round of student loan forgiveness for healthcare professionals working in underserved communities. It was a meaningful gesture, and it was, once again, incomplete. Occupational therapists were excluded. I want to put a number on what that means. In Dauphin alone, 40% of occupational therapy positions are currently vacant. 40%. That's not a staffing challenge, that's a system crisis. And because of those vacancies, outpatient services have been rerouted to Brandon, Manitoba, meaning patients are driving up to 4 hours each day for a single appointment. Some small community hospitals have experienced complete OT service disruptions. Patients who need occupational therapy in those facilities must now be transferred to other hospitals, straining patient flow across the entire region. And the OTs who remain are exhausted, burned out, leaving, making the vacancy problem worse. Dauphin is just one health region in one province. Multiply that across all of rural and remote Canada, and you begin to understand the magnitude of what we're talking about. A new OT grad today carries, on average, between $60,000 and $80,000 in student debt. Occupational therapy requires 5 to 6 years of postgraduate education. For a student from a small town or a rural community, that means years away from home, years of financial pressure, and then a choice. Take a position in an urban center where salaries are more competitive and professional supports are stronger, or return to the community that needs you, carrying debt that the system has given you no help to manage. Student loan forgiveness changes the calculus. We've seen it work for physicians, we've seen it work for nurses, and we know it will work for occupational therapists. And we have been asking for years for the chance to prove it. The Canadians waiting for occupational therapy services in underserviced communities cannot afford to keep waiting. Occupational therapists are the professionals who help people do the things that make life worth living, the daily activities most of us take for granted until illness, injury, disability, or age take them away. They help stroke survivors relearn how to cook. They help children with developmental challenges learn to write and play and participate in school. They help seniors stay safely in their homes, reducing pressure on long-term care that costs this country upwards of $80,000 per person per year. They help workers recover from injury and return to their jobs. And those are just a few examples. When OTs are absent, these costs do not disappear. They migrate. They show up in longer hospital stays, in premature admissions to long-term care, to emergency room visits that could have been prevented, and in children who fall further behind because the early intervention that could have changed their life trajectory never came. We don't count these costs because they're hard to count. And because they're hard to count, they don't drive policy. And because they don't drive policy, the vacancies persist. The wait lists grow, and older Canadians die waiting for care they were entitled to receive. The fix we are asking for is not complicated, and it is not expensive relative to the cost of the crisis it would help prevent. There are currently 719 OTs working in rural communities across Canada, and fewer than 900 new graduates each year. Of those, perhaps 50 or even fewer with no incentives could choose to practice in these communities and benefit from the program. For a relatively small investment, the impact would be significant. Add occupational therapists to the student loan forgiveness program. Trust that the evidence and the need justifies the investment. The child in Northern Saskatchewan is still waiting. The elder in Northern Ontario is still waiting. The veteran in Cape Breton is still waiting. And in long-term care facilities across Dauphin and across this country, there are people who have run out of time to wait. The question now is how much longer? Thank you.
Good morning. I'm Julie Angelina, a second-year occupational therapy student at the University of Ottawa. I chose to study occupational therapy because I love having the ability to make a positive change in people's lives, and I've always had a general interest in human health. The path to becoming an occupational therapist is not easy. It requires years of education and training, including demanding coursework and full-time clinical placements across different areas of practice. These 1,000 hours of placement are unpaid and often require relocation, additional expenses, and putting other parts of life on hold. At the same time, we are accumulating significant student debt, often from prior undergraduate or other post-secondary education. We accept this debt because we believe in the value of this profession and its role in strengthening Canada's healthcare system. What is harder to accept is feeling undervalued compared to our colleagues on interprofessional teams. We train alongside them and will soon work with them to deliver essential services to Canadians across the country. Yet, we're not always recognized equally in programs designed to support the health workforce. As said by one of my classmates, instead of paying for a patient to take up a hospital room, forgive the loans of the people who can work to get these patients out of hospital. We are not asking for special treatment. We are asking for fairness. We are asking to be recognized as integral members of the healthcare system.
Je m'appelle Sarah Laponcé et je suis étudiante de deuxième année en ergothérapie à l'Université d'Ottawa. J'ai choisi d'étudier l'ergothérapie parce que mon père a subi une triple amputation en 2013 à la suite d'une septicémie. Sa réadaptation a nécessité l'intervention de nombreux professionnels de la santé, notamment d'ergothérapeutes, qui ont pu l'aider à reprendre les activités qu'il aime. En incluant l'ergothérapie dans le programme d'exonération de remboursement de prêts d'études canadiens, le gouvernement fédéral ne se contente pas uniquement de nous soutenir. Il contribue à garantir l'accès aux soins pour les 20% des Canadiens vivant dans des communautés rurales et éloignées. Dans ces communautés, les ergothérapeutes s'engagent à fournir des soins fondés sur les données probantes et culturellement sécurisants. Nous aidons les personnes à retourner au travail, nous soutenons celles qui vivent avec un trouble de santé mentale ou une dépendance, et nous veillons à ce que les personnes âgées puissent vivre en toute sécurité chez elles. Pourtant, alors que nous nous préparons à entrer sur le marché du travail, nous constatons que notre profession n'est pas toujours reconnue de manière égale au sein du système de santé canadien. Au lieu de se diriger vers les endroits où l'on a besoin d'ergothérapeutes, comme les soins communautaires dans les zones rurales, les nouveaux diplômés sont davantage attirés par des postes offrant une stabilité financière. Les données indiquent que l'implication des ergothérapeutes provoque de meilleurs résultats chez les individus avec lesquels ils travaillent. Pourtant, cette reconnaissance ne se reflète pas toujours dans les politiques. Nous voulons changer cela. L'inclusion de l'ergothérapie dans le programme canadien d'exonération de remboursement de prêts n'est pas une demande compliquée. Il s'agit d'un investissement qui ira au-delà de notre bénéfice individuel pour toucher les communautés et les vies des personnes que nous aiderons tout au long de notre carrière. Nous sommes fiers d'entrer dans cette profession, fiers de nous tenir aux côtés de nos collègues dans le domaine des soins de la santé, et nous vous demandons, clairement et respectueusement, de nous inclure. Merci.
Good morning. My name is Lisa Diamond Burchak, and I'm the National Chair of the Canadian Association of Occupational Therapy. I've been an occupational therapist for over 35 years, working across Manitoba and British Columbia, and I've spent the past 20 years teaching and mentoring occupational therapy students at the University of Manitoba. The students are skilled, thoughtful, and eager to work in the communities across Canada that need them most, including underserved rural and remote areas. But they're graduating with significant financial pressure, and those pressures influence where they can practice. In my work in primary care, I see every day how essential occupational therapy is in people's daily lives, in their homes and in their communities. Primary care is often described as the front door of the health system, but for many people living with chronic illnesses, mental health challenges, or recovery from injury, that door needs to lead somewhere that supports real participation in real life. That's where occupational therapy comes in. It can mean supporting someone with depression to rebuild their daily routines, learning coping skills, getting dressed again, making meals, leaving the house again so they can return to work. It can mean helping an older adult manage the activities of daily living that they need to do in daily life to remain safely at home, close to family and their community supports, and avoiding hospitalization. Or it can mean working with someone with chronic pain to regain the confidence and control to do the things that matter to them and to continue participating in their community. This is primary care. This is prevention. This is system sustainability. And we are not alone in this work. We work within primary care teams that include speech-language pathologists, audiologists, dietitians, optometrists, chiropractors, naturopathic doctors, and others. Yet all of these professions, including occupational therapy, are not eligible for the Canada Student Loan Forgiveness Program. That omission matters. It shapes workforce decisions and limits access to care in the very communities that need it the most. If we're serious about strengthening primary care, our policies must reflect how care is actually delivered by teams. Including occupational therapists in the Student Loan Forgiveness Program is a practical, evidence-informed step. It would support recruitment, improve retention, and ensure that the next generation of providers can choose to practice where they are needed most. This will not solve every workforce challenge, but it will send an important message that underserved communities deserve the full range of care and that those who choose to serve them will not carry that burden alone. Occupational therapists are already doing that work. It's time for federal policy to catch up. Thank you.
Thank you. We don't have any questions at the moment. Nous n'avons pas de questions pour le moment. This concludes the press conference. C'est ce qui met fin à cette conférence de presse.